think it's a great question. I think the hard part is,
Where do we put it?
Right.
How do we look at it?
How do we bring that in? I mean, I see that as being one of those hurdles that we, kind of talked about, where we're threading that line between making this something that people can get into relatively easily and, and not. And then the public safety issue, which is the hard part, which I think is why it's something that I do think we ought to require, or not require, I do think we ought to make the space available on the application for it and, encourage it. I think anything we can do to encourage it helps. I would love that. It makes sense.
Would it
to
be
have a
under
pharmacist, but
product safety, like with the health department? I mean,
presumably the medical doctor would have already, given the medical certification that the person has the condition. I don't know that the health department can go beyond that. I mean, once they're certified as having the condition and meet the requirements, they would get the registration.
so there's no one that would reevaluate them to say, well, you're taking these medications and there may be a cross-reactive.
Hopefully the medical doctor would take that into consideration.
No.
That's- It does
So
require.
I think that with the medical doctor, they're just saying that they have this disorder. Yeah, they're
Well-
not gonna be required
Not
to,
prescribing
yeah, they're not prescribing it or recommending it, they're just saying you have cancer.
Well, currently there is a bill that would change that, but currently what is in the Constitution would require them to certify that the benefit from getting the medical marijuana would outweigh any risk.
But aren't they trying to change that?
They are trying to change that,
So-
but you would still have to have a doctor-patient relationship, and I would hope that a doctor who is doing this would take that into consideration. But it's really not, it's not something we're going to be able to look at. But there is talk about whether or not the dispensaries will have to look up on the prescription drug monitoring program to see if there are any opioids being used. Now, if there are, I'm not sure what's going to be.
It's like for us now, herbs are a big issue when you have surgery. And people will take herbs and then will have problems with bleeding. Well, we have to provide a list of herbs now that could cause bleeding. I mean, or when I get in there to operate, that patient may bleed. The patients don't know that. We have to take that responsibility. If you're taking this, you have to stop it. I didn't prescribe it to them, but I do have to provide them. So somebody's gonna have to be responsible, I agree, with providing that information, whether it's the person that's giving them they just can't be out there. I'm just saying, somebody's gonna have to eventually take responsibility. And probably will fall on the medical provider, but I'm just saying that someone is going to have to check that. It would be great if we start somewhere within the places giving it to them, or allowing them to buy it.
The problem may be the only person that knows what that individual may be taking, whether they're herbs or other prescriptions, is going to be the medical doctor.
Yeah.
If anyone knows. And so I just don't know even how you do quality, checks, or quality assurances, because we're not going to have that in our record. What other things that person may be taking, or what other problems they might have, what other conditions they may have.
This is running flat into the issue with the federal complications, where as long as it's still Schedule 1 and there are issues for the doctors and pharmacists to be involved with providing or authorizing the use of this product, it's difficult to write the kind of checks that we see in for other prescriptions. Our HB 1056 is the one that changes the certification program, which passed the House earlier today and will be sent to the Senate. And whether or not the most appropriate person to be able to gauge potential interactions between the use of medical marijuana and other products would be the existing physician may be a question for whether the medical board wants to issue a best practices guidance to any medical practitioner who's going to sign those certifications in the state.